wants to get rid of the Affordable Care Act. He's been running on that. He ran on that, and he's been governing on that. He's in the Supreme Court right now trying to get rid of the Affordable Care Act, which will strip 20 million people from having insurance, health insurance now, if it goes into court. And the justice, and I have nothing, I'm not opposed to the justice. She seems like a very fine person. But she's written before she went on the bench, which is her right, that she thinks that the Affordable Care Act is not constitutional. The other thing that's on the court, and if it's struck down, what happens? Women's rights are fundamentally changed. Once again, a woman could be pay more money because she has a pre-existing condition of pregnancy. They were able to charge a woman more for the same exact procedure a man gets. And that ended when we, in fact, passed the Affordable Care Act. And there's 100 million people who have pre-existing conditions, and they'll be taken away as well. Those pre-existing conditions, the insurance companies are going to love this. And so it's just not appropriate to do this before this election. If he wins the election and the Senate is Democrat or Republican, then he goes forward. If not, we should wait until February.
All right.
There aren't 100 million people with pre-existing conditions. As far as the say is concerned, the people already had their say. Okay, Justice Ginsburg said very powerfully, very strongly, at some point, 10 years ago or so, she said a president and the Senate is elected for a period of time, but a president's elected for 4 years. We're not elected for 3 years. I'm not elected for 3 years. So we have the Senate, we have a president.
He's elected to the next
during
election.
that period of time, we have an opening. I'm not elected for 3 years. I'm elected for 4 years. And the 100 million people, Joe, the 100 million people is totally wrong. I don't know where you got that number. The bigger problem that you have is that you're going to extinguish 180 million people with their private health care that they're very
That's
happy with.
simply not true.
Well, you're certainly going to socialist. You're going to socialist medicine.
We're now into, gentlemen, we're now into open discussion.
Open discussion.
Open discussion. Yes, I agree. Go ahead, Vice President.
Number one, he knows that what I proposed. What I proposed is that we expand Obamacare and we increase it. We do not wipe any. And one of the big debates we had with 23 of my colleagues trying to win the nomination that I won were saying that Biden wanted to allow people to have private insurance still. They can. They do. They will under my proposal.
It's not what you've said,
But
and it's not what your party has said.
That is simply
your party
a lie.
doesn't say it. Your party wants to go socialist medicine.
My party is
and
me.
socialist
right
healthcare.
now, I am
and
the
they're going to dominate
party.
you, Joe. You know that.
I am the Democratic Party right now. The platform of the
Not according
Democratic
to
Party
Harris.
is what I, in fact, approved of. What I approved of. Now, here's the deal. The deal is that it's going to wipe out pre-existing conditions. And by the way, the 200,000 people that have died on his watch, how many of those have survived? Well, there's 7 million people that contracted COVID. What does it mean for them going forward if you strike down the Affordable Care Act?
Joe, you've had 308,000 military people dying because you couldn't provide them proper health care in the military. So don't tell me about this.
I'm happy to talk about this.
And if you were here,
Look,
it wouldn't be 200. It would be 2 million people because you were very late on the draw. You didn't want me to ban China, which was heavily infected. You didn't want me to ban
all right, gentlemen,
Europe, which was heavily infected. You would have been much later, Joe.
Mr. President,
much later.
Mr. President.
You're talking about 2 million people.
You're
Mr.
not
President, as a moderator, we are going to talk about COVID in the next segment, but go ahead.
Let me finish. The point is that the president also is opposed to Roe v. Wade. That's on the ballot as well in the court. And so that's also at stake right now. And so the election is already
You don't know it's
begun.
on the ballot. Why is it on the ballot?
Because
Why is it on the ballot? It's not on the ballot.
It's on the ballot in the court.
I don't think so.
In the court. Well,
there's nothing happening there.
Donald, would you
and
just
you don't
be quiet
know
for a
her
minute?
view on Roe v. Wade. You
I
don't know her view.
Well, all right. Let's talk. We got a lot to unpack here, gentlemen. We got a lot of time. So on health care, and then we'll come back to Roe v. Wade.
All right.
Mr. President, the Supreme Court will hear a case a week after the election in which the Trump administration, along with 18 state attorneys general, are seeking to overturn Obamacare, to end Obamacare. You have spent the last...
Because they want to give good health care.
If I may ask my question, sir.
Good health care.
Over the last 4 years, you have promised to repeal and replace Obamacare, but you have never in these 4 years come up with a plan, a comprehensive plan to replace Obamacare.
Of course I have.
Well,
I got rid of the individual mandate.
I'm going to give you an opportunity.
I got rid of the individual mandate, which was a big chunk of
comprehensive
That
plan.
is absolutely a big thing. That was the worst part of Obamacare.
Sir,
Chris,
you're
that was the
debating
worst
him,
part
not
of
me.
Obama.
Let me ask my question.
Well, I'll ask Joe.
The
individual mandate was the most unpopular aspect of Obamacare. I got rid of it.
I'd like
and we will protect
Mr.
people
President,
with
I'm the
pre-existing
moderator of this
conditions.
debate, and I would like you to let me ask my question, and then you can answer your
ahead.
question. You, in the course of these 4 years, have never come up with a comprehensive plan to replace Obamacare, and just this last Thursday, you signed a largely symbolic executive order to protect people with pre-existing conditions 5 days before this debate. So my question, sir, is what is the Trump health care plan?
Fine. Well, first of all, I guess I'm debating you, not him, but that's okay. I'm not surprised. Let me just tell you something, that there's nothing symbolic. I'm cutting drug prices. I'm going with favored nations, which no president has the courage to do because you're going against Big Pharma. Drug prices will be coming down 80 or 90%. You could have done it during your 47-year period in government, but you didn't do it. Nobody's done it. So we're cutting health care. All of the things that we've done, insulin. I'll give you an example. Insulin. It was destroying families, destroying people. The cost, I'm getting it for so cheap. It's like water, you want to know the truth. So cheap. Take a look at all of the drugs what we're doing, prescription drug prices. We're going to allow our governors now to go to other countries to buy drugs because they pay just a tiny fraction.
As I say, this is open discussion.
No,
let me
but
ask
this
you
is
about,
big.
This
is big stuff.
Sir, you'll be happy. I'm about to pick up on one of your points to ask the Vice President, which is he points out that you would like to add a public option to Obamacare. And
yes.
The argument that he makes and other Republicans make is that that is going to end private insurance.
It is
and
not.
Well, if I can ask you the question, it will
not
end.
What your party says, by the way.
It will end private insurance and create a government takeover of health care.
It does not. It's only for those people who are so poor they qualify for Medicaid. They can get that free in most states, except governors who want to deny people who are poor Medicaid. Anyone who qualifies for Medicare Medicaid would automatically be enrolled in the public option. The vast majority of the American people would still not be in that option, number one.
Joe, you agreed with Bernie Sanders, who's far left, on the manifesto, we call it. And that gives you socialized medicine.
Look, hey, I'm not going to listen to him. The fact of the matter is, I beat Bernie Sanders.
Not by much.
I beat him a whole hell of a lot. I'm here standing facing you, old buddy.
Pocahontas would have left 2 days early. You would have lost every primary.
All he knows how to
on
do
Super
is hurt.
Tuesday. You got very lucky.
Here's the deal. I got very lucky. I'm going to get very lucky tonight as well. And tonight I'm going to make sure, because here's the deal. Here's the deal. The fact is that everything he's saying so far is simply a lie. I'm not here to call out his lies. Everybody knows he's a liar.
But you
I just want to make sure.
Joe, you're the liar.
I want to make sure.
You graduated last in your class, not first in your class.
I want to make
Mr.
sure.
Mr. President, can you let him finish, sir?
No, he doesn't know how to do that. He has,
You'd be surprised.
You picked
You'd be surprised.
the wrong guy, the wrong night at the wrong time.
Listen, you agreed with
Here's
Bernie
the deal.
Sanders to the
The
manifesto.
whole idea.
Let him.
There is no manifesto, number one.
Please let him speak, Mr.
Number
President.
two.
You just lost the left.
Number two.
You just lost the left. You agreed with Bernie Sanders on a plan
folks,
absolutely
folks,
agreed
do you have
to,
any
and under that
idea
plan,
what
you have
this clown's
socialized,
doing?
They call it
Mr.
Do you have any do?
socialized medicine.
Mr.
Well,
President.
I tell you what, he is not for any help for people needing health care. Because he, in fact, already has cost 10 million people their health care that they had from their employers because of his recession. Number one. Number two, there are 20 million people getting health care through Obamacare now that he wants to take it away. He won't ever look you in the eye and say that's what he wants to do. Take it away.
No, I want to give them better health care at a much lower price because
and by
Obamacare
the way, he doesn't
is
know
no
how.
good.
He doesn't know how
I've
to do
already
that.
Fixed it.
He has never
I've
offered a
fixed
plan.
it to an extent.
He has never done a
as
single
you might
thing.
know, but probably don't.
Gentlemen, you realize if you're both speaking at the same
good,
time,
and it's too expensive.
let the president go ahead, sir.
Obamacare is no good. We made it better, and I had a choice to make very early on. We took away the individual mandate. We guarantee pre-existing conditions, but took away the individual mandate. Listen, this is the way it is. And that destroyed They shouldn't even call it Obamacare. Then I had a choice to make. Do I let my people run it really well or badly? Yeah. If I run it badly, they'll probably blame him, but they'll blame me. But more importantly, I want to help people, okay? I said, you got to run it so well.
That's what
and I just had a meeting with them. They said, the problem is no matter how well you run Obamacare, it's a disaster. It's too expensive.
Okay.
Premiums are too high, and it doesn't work. So we do want to get rid of it.
Chris,
we want to get rid of it.
I understand it, sir, but I have to give you roughly equal time.
Good.
Please let the vice president talk.
Good.
He has no plan for health care.
Of course we do.
Please.
He sends out wishful thinking. He has executive orders that have no power. He hasn't lowered drug costs for anybody. He's been promising a health care plan since he got elected. He has none, like almost everything else he talks about. He does not have a plan. He doesn't have a plan. And the fact is, this man doesn't know what he's talking about.
All right.